The symptoms of heart failure that will present themselves in our patients are entirely dependent on the type of heart failure they're having. Now, if you're a cardiac specialist or advanced practice nurse, you'll learn more about combined type heart failure, preserved ejection fraction heart failure, and other details. But for now, and for the purpose of this cheat sheet, I want you to understand the basic difference between left and right-sided heart failure. The foundation for understanding this is knowing the blood flow through the heart and how it works. So if you don't feel comfortable with that, go back to that cheat sheet and watch that video again. The basis of heart failure is what we call pump failure. The heart is our pump. If the right side of the heart fails, this means it isn't pumping blood forward. So if the right side of our heart fails, blood's not going forward. If the blood doesn't go forward, it begins to back up. Think about blood flow through the heart. If it backs up from the right side of the heart, it backs up into the body because we're trying to push blood into our lungs from our right side. And so if it backs up, it's backing up from right here on backwards into the body. So the symptoms presented are related to peripheral congestion or congestion of blood in the body. The patient will present with peripheral edema, ascites, as well as signs of liver and GI tract congestion, to include upper right quadrant pain, anorexia, GI upset, and weight loss. They may also have red in face and the presence of JVD, or jugular venous distention. This vein right here, okay? If the left side of the heart backs up, so that means blood's coming back into the heart, it's pumping into the lungs, but then our aortic valve, or the left side of the heart, isn't getting blood back out into the body. So blood is going to back up in the lungs. So we're going to see signs of pulmonary congestion because it's stopped right here, and so everything's kind of building up as far forward as it can get. This includes impaired gas exchange and signs of hypoxia like cyanosis and decreased oxygen status, as well as pulmonary edema. The patient may present with orthopnea, paroxysmal nocturnal dyspnea, and a cough with frothy sputum. They tend to be more pale and bordering on cyanotic. Whether it's right-sided failure or left-sided failure, there is a marked decrease in cardiac output. Think about it. The heart has failed, our pump has failed, and it's not getting stuff where it needs to go. Physiologically, this tends to be more prominent in left-sided heart failure. However, it's present in both types of pump failure. With decreased cardiac output, regardless of the source, you'll find activity intolerance and signs of decreased perfusion, such as weak pulses, prolonged capillary refill, and decreased blood pressures. Now, treatment is based on the cause and supporting the symptoms. Understanding this can help you support your heart failure patient in the right way.